Diabetes. It's a word we hear often, but its impact is far greater than many realize. Did you know that nearly 500 million people worldwide are living with this chronic disease? That's roughly the entire population of the European Union. Even more concerning, diabetes is a leading cause of heart disease, stroke, blindness, and lower limb amputations. These statistics are alarming, but the good news is that we can take steps to protect ourselves and our loved ones. This essay will break down the complexities of diabetes into easily digestible information. We'll explore the different types of diabetes, the risk factors involved, and most importantly, the preventative measures you can take to lower your risk. Knowledge is power, and understanding diabetes is the first step towards a healthier future. Let's first understand type 1 diabetes, often diagnosed in childhood or adolescence. This type is an autoimmune disease, meaning the body's immune system mistakenly attacks the insulin-producing cells in the pancreas. Insulin is like a key that unlocks our cells, allowing glucose or sugar from the food we eat to enter and provide energy. Without insulin, glucose builds up in the bloodstream, leading to various health problems. While the exact cause of this autoimmune response is unknown, scientists believe a combination of genetic predisposition and environmental triggers might be responsible. It's important to note that type 1 diabetes is not caused by lifestyle choices and cannot be prevented with current medical knowledge. However, with proper management through insulin therapy, regular blood sugar monitoring, and a healthy lifestyle, individuals with type 1 diabetes can live full and active lives. Unlike type 1, type 2 diabetes is often preventable. In this type, the body either doesn't produce enough insulin or becomes resistant to its effects, leading to elevated blood sugar levels. While genetics plays a role, lifestyle factors are major contributors to type 2 diabetes. One of the biggest culprits is obesity, particularly abdominal obesity. Excess weight, especially around the midsection, can interfere with insulin's ability to function properly. A sedentary lifestyle characterized by prolonged periods of inactivity further exacerbates the risk. Couple this with a diet high in processed foods, sugary drinks, and unhealthy fats, and you have a recipe for disaster. Gestational diabetes is a type of diabetes that develops during pregnancy, usually around the 24th week. It occurs when hormonal changes during pregnancy affect the body's ability to use insulin effectively. While gestational diabetes typically resolves after delivery, it can pose health risks for both mother and baby. Women with gestational diabetes are at an increased risk of developing high blood pressure during pregnancy, also known as preeclampsia, and requiring a cesarean section. Their babies are also at higher risk of being born prematurely, having breathing difficulties, or developing low blood sugar after birth. The good news is that gestational diabetes can often be managed with dietary changes and regular exercise. Early screening and diagnosis are crucial to minimize potential risks. Section 5. Beyond type 1 and 2, other factors at play. While type 1 and type 2 are the most common forms of diabetes, other factors can contribute to the development of the disease. Certain medications, such as corticosteroids used to treat inflammation, can temporarily or permanently raise blood sugar levels. Hormonal disorders like polycystic ovary syndrome can also disrupt insulin sensitivity and increase diabetes risk. Additionally, age is a significant factor, as the risk of developing type 2 diabetes increases as we get older, particularly after age 45. This is due to a natural decline in pancreatic function and age-related weight gain. Section 6. Preventing diabetes, taking charge of your health. The good news is that we have significant control over our diabetes risk, especially for type 2. By adopting a healthy lifestyle, we can drastically reduce our chances of developing this chronic condition. One of the most impactful steps is to prioritize a balanced and nutritious diet. Focus on consuming whole, unprocessed foods such as fruits, vegetables, lean proteins, and whole grains. Limit your intake of sugary drinks, processed snacks, and unhealthy fats. Small changes like swapping soda for water or choosing fruit over a cookie can make a big difference. Section 7. Small steps, big impact, your journey to a healthier you. Regular physical activity is another cornerstone of diabetes prevention. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week. This could include activities like brisk walking, swimming, cycling, or dancing. Don't be afraid to start small and gradually increase your activity level. Even incorporating short bursts of movement throughout your day, like taking the stairs instead of the elevator or going for a walk during your lunch break, can have a positive impact. Section 8. The power of knowledge. Understanding your risk. Managing weight is crucial in preventing type 2 diabetes. If you are overweight or obese, losing even a small amount of weight, 5 to 7% of your body weight, can significantly reduce your risk. This can be achieved through a combination of healthy eating and regular exercise. It's essential to understand your personal risk factors. If you have a family history of diabetes, are overweight or obese, have a sedentary lifestyle, or have other risk factors like PCOS, talk to your doctor about getting regular blood sugar screenings. Early detection and intervention are key to preventing complications. Section 9. Conclusion. A healthier future starts today. Diabetes is a global epidemic, but it's not an unbeatable one. By understanding the different types of diabetes, recognizing our risk factors, and adopting a proactive approach to our health, we can significantly reduce our chances of developing this chronic condition. Remember, small changes can have a big impact. Let's choose to prioritize our health and inspire those around us to do the same. Together, we can create a healthier future for ourselves and generations to come.